Hey guys, Dr. Ben here, Functional Medicine Centers, and welcome to our talk today about vitamin D, about the immune system, about COVID, everything we need to know to get your body functioning as well as feasibly possible to not just handle this virus, the next bacteria, whatever is coming at you. Remember, being strong is way more effective than being safe. So some new information coming out, some new research, some new studies showing some fascinating things that are going on with vitamin D and with virus protection and all types of things. So for any of those that you are watching, Carol, Paula, good to see you guys jumping on. Angela, go ahead and put down below where you guys are watching in from. We'd love to see where everyone's coming in from. And then I can give a shout out if you've got any specific questions. This today's going to be a little bit more of a Q&A as well, but vitamin D is going to be huge when we're talking about COVID prevention, getting the kids out to school, all these different things. So, hey everybody jumping on, good to see you. All right, vitamin D, we've been talking about this ever since all the way back in March, in February, when we first heard about this virus coming over from China, this virus that was going around the world, and we were seeing these reports that vitamin D is crucial for that. Hey Destiny, good to see you. We'll get to what causes that vitamin D deficiency in just a second. So here we go. Vitamin D is crucial. We've been doing this for years. If somebody has a bacterial infection, a viral infection, anything like that, a patient, we will give them 50,000 IU of vitamin D per day for 3 days. And that is going to be a huge immune system boost for anybody. So we've known this for years, that vitamin D is crucial for immune system function. So we've got to be able to get this as stable as possible. Hey everybody, I'll go through, hey Haley, I'll go through and say hi to everybody here in a second. I just want to get some of these thoughts down and then make sure you put some questions in there as well, and we'll get through these. So vitamin D, crucial. We like vitamin D. If you've had your vitamin D tested lately, or if you haven't, you need to get your vitamin D tested. You need to be between 60 and 80. So write this down. Your vitamin D needs to be between 60 and 80. And a lot of people ask, how much vitamin D should I be taking? Some people it's 1,000, some people it's 10,000. We have some people go up to 15,000 IUs of vitamin D per day because they are so deficient in their vitamin D level. Speaking of vitamin D deficiency, Destiny wrote in from Florida there, why are we so deficient? Well, amazingly, right now, today, you should be the highest vitamin D of the entire year. Why? Because we're coming off of summer, we're coming off of sunshine, we're starting to go downhill, we're gonna actually have less sun for the duration, for the next 6 months or so. So today should be the highest amount of vitamin D that your body should have. But guess what? I test vitamin D every single day on people. We test, retest, we've been testing it for years. We average 25 to 35 in what we see for patients. And you know what? I've seen more teens this year. I've seen more single digits, way more deficiency than ever for this time of year. Why? Destiny was asking, why are we deficient? And a big part of that is because we're not getting the sunshine. So I'm looking out here over the soccer field next to my office here, and we are not getting enough sunshine. People have been quarantined. People have been staying inside. They've been told, don't go out to the park, don't go places, stay inside, shelter inside, all of those things. And so we've actually gotten less vitamin D this year, and I've seen way more deficiency than ever on vitamin D. And it's pretty scary when all we really need to be doing is getting outside. I've also seen 2 people that have had higher vitamin D up in the 50s and 60s without taking any supplementation. Why? Because they're working from home. They've got their laptop outside, sitting on the porch, 5-6 hours a day of sunshine. I was like, wow, that's the best tan I've seen in a long time. And you know what? They have vitamin D levels that are really, really good. So that's what we look at. You've got to get outside. And Destiny, yours was down at 19, and that, I'll tell you why that's so profound for people's immune systems and the problems that are coming from this. So one really interesting study, this just came out. This was published on August 29th in the Spanish journal. It was a Spanish study, so Spain had a lot of COVID cases, and so they did some things. So one group of people, both groups, they gave the standard of care, which is hydroxychloroquine and zithromycin. So the standard of care for dealing with COVID now, according to this study and most people, is the hydroxychloroquine and the zithromycin, and so that's an anti-malarial drug as well as an antibiotic. But what they did differently in this study, they gave one group vitamin D and the other group had no vitamin D, and pretty substantial amount. On day one, they gave them 100,000 IU of vitamin D. On day 3 and day 7, they gave them 50,000 IU of vitamin D, and then once per week they gave them 50,000 until they were omitted or died. So none of the people died on the vitamin D side, and the number that went to the ICU was only 2% of the people in the vitamin D side of the study, where the people that did not get vitamin D, listen to this, 50% of the people that did not get vitamin D but still did the hydroxychloroquine and the zithromycin still went to the ICU. So only 2% in the vitamin D group, 50% in the non-vitamin D group. And this is using standard of care, hydroxychloroquine and the zithromycin. So not only were they using what works, but once they added that vitamin D in, it dramatically dropped the amount of ICU for these patients. So this was a study just came out August 29th, pretty profound. Another study in the JAMA, Journal of American Medical Association, they showed that people that were deficient in vitamin D were 1.77, almost 2 times more likely to get COVID, and people that were positive from COVID were 2 times as likely to be deficient in vitamin D. So dramatic the amount of increase in problems if people are deficient in vitamin D. Another study showed people that were positive for COVID had an average vitamin D level of 11.1. Very, very low. We like it 60 to 80. 30 is the lab cutoff. They were at 11.1 for everybody that was positive. For everybody that was negative, 24.6. Still low, but a significant difference in that level as well. So vitamin D, a huge part of the puzzle piece here, a huge part of this process. It's an immunostimulator, but it also modulates that immune response, meaning it's going to balance it out. We give it to people with autoimmunity all the time, and it will balance out that autoimmunity. So if you have not had your vitamin D tested lately, or if you have, look at your blood work and write this down. You want to be between 60 and 80 is where you want that to be. Also, if you look at the numbers of people of color, African American, Hispanic, Mexican American, things like that, they have much higher COVID rates and COVID fatalities. Why is that? Well, a big part of that is because their vitamin D levels are significantly lower, meaning like 20, 30, 40% lower than Caucasian or white people. So when they are doing vaccine studies and they only have like 2 or 3% of the population of people in that vaccine study are actually people of color, there's a reason why they're telling them go back and start the study over, because it is not going to be very accurate, because it's going to be, these people are not going to be the ones that are going to be having as many problems as the people of color, because their vitamin D levels are very, very low. Did you guys see last week Dr. Fauci came out, and Dr. Fauci said, hey, I take vitamin D and I take vitamin C. And he said vitamin C, 1,000 milligrams of that a day, but vitamin D, he said, absolutely, there's plenty of studies showing that that helps to prevent viral infections, help calm down that immune response. He even said this back in 2016. He wrote a paper on it saying the things that he does, being around people every single day, what he can do and what you can do to prevent viruses and bacteria. And so that is where vitamin D comes into play. Even Dr. Fauci is using it. Again, this is the worst vitamin D levels that I've seen ever in practice over the last few months. And that's even though we're supposed to be at this moment in the highest vitamin D level that we possibly can be in. So here's physiologically what happens in the body with COVID and what vitamin D can do that. So vitamin D will stop and slow down what we call a bradykinin storm. So we had talked about a cytokine storm before, and bradykinin storm is going to be what regulates blood pressure. And this is when COVID comes in, it blocks the body's ability to break down this bradykinin, which is going to create this inflammatory cascade, and it's going to affect actually more of the vascular system, which is the blood vessels, things like that, as opposed to the lungs. So we see this all the time with patients. A lot of people thought that this was a lung disease, but it is actually more of a blood vessel cardiovascular. That's why 1 in 5 patients that go to the hospital actually have some type of cardiovascular issue coming out of the hospital and damage to their heart because of this bradykinin. But vitamin D modulates that bradykinin. It can slow it down and it can stop that inflammatory cascade that's coming on. So again, if you have not tested your vitamin D, test it. Super easy blood test, totally quick and easy to do. You need to be between 60 and 80 and take appropriate amounts to get there. Some people need 5,000, 10,000, even 15,000 a day to get to where they need to be. So another interesting part, over this entire course of time, we have not had a patient of ours that's active in care that has been one of our patients that has had a full-blown COVID infection. They may have tested positive for something, but they did not have a full-blown infection. And I think a big part of that is because we have gotten those patients vitamin D to where they need to be. So what we're looking at, I'm going to roll back here. What we're looking at is vitamin D is a huge part of the immune modulating system. It's going to help autoimmune patients. If someone's revved up too high or calmed down too low, it's going to help modulate that, but we've got to get this balanced out. So I'm going to go through some questions here. Hey, Doris out in Gordon, good to see you. So again, Destiny asked, what causes vitamin D deficiency? We see more deficiency now than we have throughout my entire career, over 20 years in practice. Why? Because people have been sheltering in home, they've been hiding out, they've been quarantined, all these things. And interesting, when we talk about quarantine, the latest research, there was just a study in the New York Times, they were talking about it last week, that showed 90% of infections, of positive cases, were not truly infections. They didn't need to quarantine, they didn't need to stay home from work, any of that. Actually, 90% of positive PCR tests are too sensitive and they're not true infections. So pretty interesting. Hey, Donna in South Dakota. And Marilyn and Haley there. Paula, good to see you. Deidre in Lubbock. Shout out to all of our Lubbock friends. Brandy's out there as well. Let's see. Candy, good to see you. And can any foods block or negatively impact vitamin D? We've seen inflammatory foods. Blood sugar can be an issue with vitamin D absorption. So anything you can do to get your inflammation down is going to be huge for part of this process. Go ahead, if you guys are just jumping on, put down below where you're calling in from, where you're watching from. Destiny, yes, yours was down at 19, and I go out in the sun and supplement feeling much better. So I always joke, you need to be out in the sun between 11 and 1 every day in your bikini to truly get enough vitamin D to fight off any of those infections. Teresa, Brenda, Sonia, good to see you. Hope everything's going well there. Does sunscreen make it harder to get vitamin D? Absolutely. Sunscreen, especially the really high dose kinds of sunscreen, are going to block vitamin D. One of the big reasons why we're so vitamin D deficient. We need good sunshine. But as soon as you start to get a little bit hot, a little bit pink, that's when you need to come out. You don't want to get burnt. That's when the damage takes place. Also, our glasses, most of the vitamin D absorption is actually in our eyelids. So that absorption is coming in from those eyelids if you're wearing sunglasses. But even regular glasses have a lot of UV protection in there. So Angie, good to see you. Carrie, Brenda, good to see you guys. I know there was a couple other questions on here. Cami from Wyoming, great to see you. And let's see, Tina and Carla. Just had mine checked, it was 93. Should I reduce the amount I take? Cynthia, at 93, anything under 100, you're at a safe zone. Odds are it's only going to go down from here. So if you were taking that amount of vitamin D for a long time and it was the same dose and you're at 93, you'd probably be fine to continue. If you just bumped it up and it was still going up, because remember, vitamin D is fat soluble, so it builds up over time, unlike a B vitamin where you're going to pee that B vitamin out. That's why it's like bright yellow the next day. Vitamin D, you won't just urinate out. It's going to actually build up over time. So if you're still going up, then you probably want to come down. But if you've had it up at that 93 for a while, it's probably fine to keep it there, because you're going to only go down. Amy, good to see you as well. What about zinc? Paula, so zinc is huge. Zinc is going to be a very big part of antiviral. This is one of the reasons why hydroxychloroquine is so effective. Hydroxychloroquine is a zinc ionophore, meaning it's going to get that zinc into the cells. Quercetin is a natural alternative to hydroxychloroquine because it's also a zinc ionophore. So you want to take your zinc and your quercetin at night, even preventatively, and that's going to help get that zinc into the cell, and that's going to be a big preventative part of any virus. So absolutely zinc. Yes, in that Spanish study they used hydroxychloroquine, they used zithromycin. I did not see anything in the research about zinc on that one, but they called that the standard of care, and the only thing they did different in that Spanish study was that they added vitamin D in, and it dropped the ICU rate from 50% down to 2%. So huge drop through there. Hey, Shauna, good to see you. Christy, Devin, good to see you as well. That's great. So Destiny, there's an app on your phone, D-Minder, that tells you what position of the sun based on your location and where to get that vitamin D. That's cool. I haven't seen that one yet. Donna, what needs to be taken with vitamin D for maximum absorption? So a lot of people will take vitamin D with fat, and that's why you see some of the supplements, they'll be in olive oil based, they'll be in some different things, but taking it with some sort of fat has been shown to be effective for people to absorb more of that vitamin D. It is fat soluble. It doesn't just go straight through the digestive tract like normal vitamins. It's going to be absorbed into the lymphatic system as well. Renee, good to see you. Ralph, Devin in Michigan, good to see you. And let's see, Jerry in Snowflake, Arizona, Patty in Arnold. We get a lot of people out from Arnold in Nebraska. That's great. Laura, D3 and K2, shrinking fibroids. Great to hear it. You know, that's one of the things that can happen is those fat soluble vitamins can help that immune system, can help that inflammatory process and start calming some of these down. Brenda, good to see you out there in Dodge. Hardy, Nebraska, great to see you. Janet, what foods will help supplement vitamin D? So sardines are going to be helpful. Everybody loves sardines, right? So sardines are really good. We've got cod liver oil. Why is it all these yucky tasting things, right? Now, actually, I love sardines, but cod liver oil and sardines are going to be some of the best sources of vitamin D. So getting some fish in every week is going to be helpful as well. Laura in Ohio, great to see you. Carol, good to see you as well. Cindy, Gina, all right. Is there any way to check your vitamin D levels without doing a blood test or having to go to a doctor? Yes, there is a way that you can do that at home, and I'll post that down below. I can't remember the website offhand, but there is a way that they'll actually drop ship you a vitamin D test, and you can do it at home. I think it might even be just a spot test that'll tell you where you are, but I'll put that one down below for you, Mandy. We'll see that one. Does K2 help increase vitamin D absorption? You know, we've tried vitamin D, vitamin K, vitamin D by itself, vitamin D with fat, a lot of different ways, and we haven't seen a huge difference in vitamin D absorption. That's one of the reasons why that we do not do the vitamin D and K for those of you that are patients out there. We just haven't seen it be that effective and be that necessary. So some people, they like how their body feels with K, and there is some research that shows there's constructive things that happen with vitamin K, but we just haven't seen it be that big of a thing. Hey Renee, hey Mom, good to see you out there. Hope you're feeling well today. And then Cindy and Ogallala, and Renee, good to see you as well. I know you did a lot of work. Renee said that I believe you helped me avoid COVID through your care, and that's what we were saying. I haven't seen any of my patients have a true COVID infection because I think one of the main reasons is we get their vitamin D up where it needs to be. We get their blood sugar stabilized, we get their inflammation down, get their liver working better, and their brain and heart and everything else. Hey Bren, good to see you. Gina, you are so welcome there. Laura, Ohio dental hygienist. Yeah, you're taking the wormwood, vitamin D, and vitamin K2. That's one of the best things you can do. God bless all you dental hygienists and everybody in the dental field. My brother's a dentist, and it's intense. You know, can you imagine sitting there in somebody's mouth, like playing around, and they're like gagging and spit coming out and everything like that? So you guys better make sure that your immune system is working as well as it can. Yeah, Paula, I agree. If you don't need the K2, I don't think it's necessary at this point. That's why we've never had you guys take any as patients there. Hey Carol, good to see you as well. So let's recap a couple things. So vitamin D, one of the biggest things you can do to help prevent COVID, prevent any type of virus, bacteria. My kids' school, they already had a little cold go around. Everybody was sniffling and sneezing, and a couple of the kids stayed home for a few days. But you know what? Those are going to continue to happen. Those immune things are going to happen forever, whether we get a COVID vaccine or we don't, or this one burns out, which I think it will happen, is the COVID-19 will burn out, and within the next 6 months, 9 months, we're going to have moved through almost everybody. You want your vitamin D 60 to 80. If you have not tested your vitamin D lately, it needs to be between 60 and 80, and even if you have tested it, you've got to get it up there. Some people 5, 10, 15,000 IU a day it takes to get there. We know that people of color, African American descent, if they're Hispanic, Mexican American, anything like that, they have much higher rates of COVID. Almost 50% of the deaths in this country are of people of color. And so we know that even 12% of the cases are African American, where 25% of the deaths are African American. So twice as likely to die if you're African American versus if you're Caucasian. And why? Because a big part of that, people of color have lower vitamin D, and like significantly lower vitamin D. Their body does not absorb as well. So if you are dark skinned, you need to absolutely 100% be taking that vitamin D. Another study in the Journal of American Medical Association in JAMA, it showed that people that were positive for COVID were 2 times more likely to be deficient in vitamin D. Another study showed that people that were positive for COVID-19 had an average vitamin D of 11.1 versus people that were negative were 24.6. Still really low, but not as significantly low as that 11.1. So We know vitamin D, the most important thing you can do today at this moment to get your immune system working as well as it can. If you have autoimmune, you need to be up at least 80 on your vitamin D. So if you guys have any other questions, if anybody's watching this down the road, go ahead and pop those down below. Like or share this with anybody that you know that is worried about COVID, worried about their immune system, wants their body to be as strong as possible. We tell people in the functional medicine world all the time, it is much better to be strong than it is to be safe. So you've got to get your body in as good a place possible for whatever's coming down the line, whether it's COVID, whether it's another virus, whether it's another bacteria, anything at all. Get your body as strong as possible, and because it's about your terrain, it's not about the bug. You can get exposed to any bug out there, but if your terrain is as strong as it possibly can be, you won't have to worry about it. So I hope you guys enjoyed this. Like or follow our page. Also share this with anybody and everybody out there that you know needs this information, which is everybody, because everybody's immune system needs it. So thanks for watching in, everybody.